taking care of our actual physical body is critical to self-care. I spoke with Dr. Stephen Jacobson and Kristen Meadows from Premera Blue Cross about staying on top of our health. Dr. Jacobson, as a physician, what advice would you give people about taking care of themselves?
You know, we all should be our best advocates for our own health. It's a really an important thing in all of our lives, and there's a lot we should be doing for that. One, having a healthcare plan, including having a care team, thinking about what we're putting in our bodies through nutrition, thinking about how we move, how we exercise, and then thinking about our relationships and how do we continue to improve that.
Yeah. Let's talk about some specific health-related things that people should be doing.
Yeah, so all of us should have a primary care team, and it's always good to have a team on your side. And so if you don't have a primary care team, find one. And there's resources at Premera, there's resources in your community. Ask your family or friends who they see. The primary care team should have advice for you based on your age and your gender, what might be screenings that are appropriate, screenings for cancer, for example, or screenings, say for cholesterol or for blood pressure, or for immunizations. All of us have immunizations throughout our lives that would be helpful to keep us safe and healthy.
Just had my flu shot.
I had mine last week, so that's a great example. There you go.
Yay for us. What about nutrition? How important is it to kind of focus on that, especially if you're managing a condition like diabetes?
Oh, nutrition is so important for every single one of us, and probably even more important for people with diabetes. But what we put in our body makes a huge difference. So we should have a plan for that. Most of us should be eating more vegetables and fruits and less things that contain sugars and fats. Most of us should be drinking more water and less beverages that have sugar in them. So there's a lot of room for improvement for most of us. But I think if you focus on healthy fruits and vegetables and plenty of water, that's a good start right there.
There you go. Easy enough. Finally, what about emotional health? I know that is something that I also really have to focus on.
Yeah, we're all emotional beings, and we all have people that we interact with. And I think to have a plan on how we're going to do a better job of that. If there's damaged relationships, what we can do to improve those, what can we do to make sure we have friends in our lives, our family in our lives that are providing good feedback for us, kind of helping us to be more emotionally secure and sound. And then also having a vision or a plan for our lives. How can we give back to the community? How can I contribute in my own way? And I think when we contribute, it feels better for us. And then finally, let's practice forgiveness, both forgiving ourselves and forgiving others. Holding a grudge doesn't do anybody any good.
So true. Gosh, that's true. Kristen, Dr. Jacobson gave us some great information on what we need to be thinking about for our health, but a lot of people don't actually know how to use their healthcare plan. Any advice?
The great thing about routine care is oftentimes benefits have full coverage, so you can go to the doctor without any cost. And so I think after last year, some of that routine care may have fell to the wayside. So my ask and my wish is that everybody get out their calendar. And if you haven't scheduled that routine care, make it a priority. Even if one person walks away listening to this conversation and does just that, that's a win.
Absolutely. And knowing things about open enrollment, right?
That's right. For open enrollment is right now for Medicare Advantage and the individual market in just a few weeks. So reassessing your benefits, giving us a call to make sure you're on the right plan. If you haven't established your primary care team, we can help you with that. We can help you better understand your coverage and make sure you're getting those appointments scheduled. I know my Achilles heel is dental checkups, and so I just made it a priority to get that dental appointment scheduled.
I literally have that on my to-do list for today, but I also need to contact y'all for my primary care team because I don't have that. Kristen, understanding options outside of the ER, like urgent care, can also help manage costs and help with those medical bills, right? Especially when we have maybe a scare and we really need to think about where we need to go, right?
Absolutely. And going to our website to understand urgent care locations around where you live or where you work is a good step to take. I noticed when I was setting up some of my appointments, just places that I wasn't familiar with, or, I work most days. And so I was able to request some appointments and set that up online, even outside the typical working day. So good for me, working mom.
That's right. So for any information on what we've been discussing today, just go visit the website on your screen. Premera's website has a lot of different resources, so go check it out.